So we'll be talking about another classification of what arrhythmias today, and this is basically arrhythmias that is induced by what digoxin, or what we call what digitalis. All right, and unfortunately, the digitalis is basically like a drug that is used in treating the heart. Okay, so yeah, this drug is used in treating the heart, but this drug can also what induce some abnormal heartbeats. Okay, so we'll be looking at this condition. We said that we're talking about digitalis induced arrhythmias, which is this digitalis is also known as what digoxin, all right? And most of the times when it will induce an arrhythmia is when it's what intoxic, all right? Maybe it is in concentration is too much, all right? So digoxin toxicity. This is how a digoxin drug looks like, right? Mostly in tablet. Okay, so digoxin, sold under the brand name Lanoxin, among others, is a medication used to treat various heart conditions. Okay, so most frequently it is used for atrial fibrillations, atrial flutter, and heart failure. All right, so digoxin is one of the oldest medications used in the field of cardiology. Okay, so this is cardiac arrhythmias is basically an abnormal heartbeat. It could be that the heartbeat is too fast, or it could be that the heartbeat is too slow. Okay, so some people tend to like misunderstand the cardiac arrhythmias and feel like, okay, cardiac arrhythmias is only when the heart is beating too fast. Okay, no, it could be too fast, it could be too slow. So digitalis induced arrhythmias, or you could say digoxin induced arrhythmias. Digitalis induced arrhythmias is a form of drug induced arrhythmias. Now, digitalis use increase the intracellular concentration for calcium and may lead to premature contraction of the cardiac muscles. Okay, so this drug is used to treat some cardiac problems. Quite all right, but this drug can also lead to increase in calcium levels in the cardiac muscles. Okay, and once there's increase in the calcium levels in cardiac muscles, that's a problem. Okay, problem comes in. Okay, so this will actually decrease repolarization or time in the heart. Okay, and it will also decrease the effective refractive period. Okay, and this will lead to automaticity of the heart. Okay, the heart will just start contracting on itself too much. Do you understand? It will start contracting on itself. Okay, everything will now become automatic. Okay, so when it leads to automaticity, and thereby making the muscle cells more susceptible to development of arrhythmias. Okay, so uh, this drug is used to treat some cardiac problems, but can also lead to other cardiac problems. So digoxin toxicity will lead to a decrease in atrioventricular conduction. Okay, it leads to a decrease in impulses going down to the ventricles. Okay, so now it will increase ectopic pacemaker activity, that's automaticity. All right, and this will lead to ventricular arrhythmias. Do you understand? All right, so in overall, digoxin slows the conduction and increases the refractory period in cardiac muscles or tissues by enhancing vagal tone. Okay, so these actions of digoxin can result in almost every type of arrhythmias possible, such as extra systole. All right, that's when you're having some ectopic heartbeats, extra heartbeats. Then also paroxysmal or junctional tachycardia. Okay, that's at the junction between the atria and the ventricles. All right, because the impulses are now being reduced, you're having some abnormal heartbeats at the junction between the atria and the ventricle. All right. Guys, that's it about digitalis induced arrhythmias or digoxin toxicity induced arrhythmias. Okay, so that's it, and see you guys.